It's the nation's capital at its most quiet as Canberrans prepare for week 3 of lockdown, a sacrifice of freedom that's thankfully having the desired effect.
We've recorded 14 new cases overnight, but in good news, all of those cases are linked and 13 of them were in quarantine for their entire infectious period.
As for the remaining one, that case spent a very short period of time in the community while infectious and is considered low risk.
So thank you to those people. They've done the right thing, and by doing the right thing, they've made a big difference to our public health response.
There are now 190 active cases of COVID-19 in the ACT. Just 8 of those remain under investigation. 9 Canberrans with the virus are now in hospital, 1 in a critical condition. And the list of exposure sites has grown to more than 420. But it's a list that's now growing very slowly, with only 4 new sites added today.
I think we can be cautiously optimistic that the number of cases that we're now finding in quarantine and the number of cases that are infectious in community are trending the right way. So in quarantine's going up and infectious in community is going down.
In more good news, the Greenway Views village in Tuggeranong has escaped an outbreak of Delta, despite a partially vaccinated worker testing positive to COVID-19.
The Commonwealth has also advised us today that 82% of residential aged care staff across the ACT have now received at least 1 dose of COVID-19 vaccination.
That's almost double the figures from a fortnight ago. The virus is spreading and, overwhelmingly, it's through households and workplaces. Sonia Heaney's parents have both tested positive to COVID-19. She believes it's only a matter of time before she does too.
My father was next to me coughing a couple of days ago, so I'm just expecting it.
How the family came to be infected remains a mystery.
We were looking at the exposure sites non-stop. And the contact tracers can't find anything. So then they started looking further and further back, weeks and weeks back, and they still can't find anything. So we just don't know.
Even if the lockdown ends on September the 2nd as planned, it won't mean a return to life as we knew it.
So I need to be clear that for the next several months, the entirety of spring, very careful management is going to be necessary.
The steps out of lockdown will be slow and small and balanced with the need to protect the community from Delta. High vaccination rates will be critical, but some restrictions will have to endure until we get there. That's simply the reality for an island surrounded by a COVID-ravaged New South Wales. The Chief Minister has hinted that some changes to the current state of play will be announced tomorrow, but he has warned Canberrans not to expect a significant easing of restrictions, but rather a gentle step forward. And as for when we can expect some semblance of pre-outbreak normality, the Chief Minister says that will only come when vaccination rates in every state and territory are well above 70%. Rosie King, ABC News, Canberra.